Welcome to the Darcy Wellness Show. Today we're going to be covering diabetes, and my name is Geoff Darcy. I'm director at the Darcy Wellness Clinic, acupuncturist and herbalist. And joining with me today in the studio is Dr. Artur Gertler, medical doctor, and Yuanling Liu, acupuncturist, herbalist, and registered dietitian. It's also Yuanling's favorite subject, diabetes, so we're going to learn a lot from you two guys today. So if we could kick off by going to our first set of slides. It's pretty remarkable that we have nearly 21 million people in the US with diabetes. 14.6 million have had the diagnosis, and 6.2 million don't know they have diabetes. That's pretty amazing. So there's a population out there running around with diabetes. They don't know that they have it or they're heading towards it. And we can see on our next slide, just quickly run through these slides. If we could do these quickly, what this is showing is from 1990 onwards to 1991 onwards to 2001, the trends of diabetes. So we can see the changing colors as it's getting darker, and then again it gets darker. We can see that the country is slowly increasing in the amount of diabetes that are out there. Then comes the big bad red states that show that it's above 10% of population in that area that has diabetes. So in our following slide, after this one, is what is diabetes? And maybe we could now leave the slides and come back to you, Arthur. What is diabetes?
Well, diabetes is a disease fairly easily diagnosed in which the blood sugars are running too high, and we use a fasting blood sugar. And there are reasons, very good reasons for that.
So why is it so epidemic right now? I mean, we're in a massive, really, this amount of diabetes has never been seen on the face of the earth before. The increase, the sharp rise in the last 20 years that the U.S. has experienced. If this continues, they're saying something like 1/3 of all children being born right now are heading towards diabetes. This is going to bankrupt Medicaid and Medicare in 10, 20 years. Why is it? Why is it so rampant?
Well, I think the population experts all agree that the rise in diabetes parallels exactly the rise in obesity, and they're very closely linked. And the more overweight you are, the more severe it is, the more likely you are to be diabetic. So it's pretty much related to that.
Actually, we have those slides that we've just seen. We have also similar map, mapping out obesity and its increase in the last 25 years, and then the ones we've just seen, 2 or 3 years behind the increase in weight, is trending the diabetes increase. So as the weight increases 2 or 3 years in those same states, the rates of diabetes increase. So that backs up that point. Yuanling, this is your favorite subject.
Yes.
And I know as a dietitian you're waiting to jump in there. So why is it so rampant? Why is it so epidemic right now?
So the reason why it's my favorite topic is that this is one condition. It's preventable and very much treatable. And as Geoff was mentioning earlier, that 91% of diabetes is preventable.
Especially type 2, right?
Type 2, that's right.
We'll talk about type 1 and type 2 a little bit.
So as Arthur mentioned obesity, one thing is that when there's much more fat cell around our regular cell, they make our cell insensitive to insulin. When insulin comes, the cell doesn't even recognize. So this is one type. Another type is that when in our lifestyle and eating habit, we are really overloading and overworking our pancreas and also our liver.
Right.
So when that happens is that our pancreas cells just lost ability producing enough insulin. So when we are eating a lot of refined food, there's spike of sugar in our bloodstream, and there's not enough insulin to cover.
Right.
What insulin does is that moving the blood sugar from bloodstream into the cell, so it can be used as a fuel. And when there's not enough insulin, there are just too many sugars hanging out in our bloodstream, which creates the cardiovascular issues and many other stroke, neuropathy. There are many conditions that can come from just diabetes alone.
Yeah. So if we take a look at our next slide about the types of diabetes. So we know that there's the juvenile, that type 1 is usually diagnosed in children, and then type 2 is the most common form, most often diagnosed in adults. Gestational diabetes, appearing in pregnancy, and the high risk for type 2 diabetes is much later on in life. So, and the real sweet spot of prevention, if you were, if we go to our next slide, is this, the idea of, as you were saying, what goes wrong with diabetes. So in this diagram, you have the food is digested, the glucose is released, the pancreas releases insulin, and that helps the cells to be unlocked and receive that energy. So in slide 5, what goes wrong is the cells are unable to be open to that. Why is that? The idea that faulty insulin uptake in the cells, Artur. Why does it suddenly stop receiving?
Well, this is exactly what Yuanling was getting at when she talked about the body being insensitive to the action of insulin on the cell and able to drive the sugar into the cell that's around. 1, there's not enough insulin. 2, something happens to the cell membranes, these receptors that specifically let the insulin in and the sugar in, and it opposes the action of the insulin. It can't drive the sugar into the cell where it's supposed to be used for energy.
So is it just overworked and it just shuts down?
Well, a lot of things happen. The excess fat in the cells create a situation in the blood where there's excess fatty acids, cholesterol, and all these things add to insulin resistance. Not everything is known about insulin resistance, but we know it's directly related to too many fat cells in the body.
Yeah.
And this opposes the action of insulin in driving that sugar across the cell membranes to get into the cells where it's needed to burn for energy.
If we could go to our next slide. So unable to get into the cell to create energy. The idea of, the type 2 diabetes is the fastest growing disease in America. The average American is eating, Yuanling, 530 calories more than 1970. So and it just shows there some of the fascination that Americans have within a year. Cookies and cakes, 60 pounds in 1 year. Ice cream, 23 gallons of ice cream. 7 pounds of potato chips, 51 pounds of French fries, 57 gallons of soda pop. That's what the average American is eating, and that adds up to 530 calories more a day than in 1970. So set some perspective, Yuanling, as a registered dietitian, the idea of what should the calorie count be, and that's like, 25% or more than 530 calories than we should be intaking?
Right. So the one thing is I want to give you a perspective before we're moving on the dietary aspect, just by looking at traditional Chinese medicine point of view. So when Chinese medicine looking at the body of energy and blood system, it's supposed to be like the water in the river. There's a constant steady flow, and if you observe the water in the river, it's clean and nothing grows in the river. So however, when we by our external stress, emotional stress, and also the dietary impact that you've seen earlier in the modern society eating, we are putting a lot of constriction on the river. It's creating a pond situation.
Stagnation.
That's correct. So if you look at the pond, everything grows in the pond, the earth's rotten, the water becomes stale and dirty, and that's basically what's happening in our body. So the dampness, blood, and energy all stagnate.
With what?
Stagnate by stress, and so it accumulates in our body, creates a pond situation. Mm-hmm. So sugar hangs out in the bloodstream too long, cholesterol builds up, a lot of other things, nodules.
So this is the kind of tie-in with metabolic syndrome, with cardiovascular disease, with higher cholesterols and high blood pressure, mm-hmm. all kind of wrapping together with diabetes, and
right.
from the same pond, the stagnant pond. Yeah.
That's correct. So our system is just overloaded. So the primary thing is that, of course, the dietary contributes the number one into this, because we are constantly putting a lot of stagnant water into the pond. Yeah. So, of course, if you see earlier, the slide shows that the calories all come from empty calorie, which means it's all refined flour, it's refined sugar.
So all processed.
All processed.
Put in cans. And
right.
Have longer shelf lives.
Right. So they go into our bloodstream right away. It doesn't even require much of digesting time. So if I drink a cup of soda, the blood sugar goes up in half an hour, sky high. And then the pancreas has to work really hard to produce insulin at a short amount of time.
So it's like throwing gasoline on a fire.
That's correct.
It flares up, and then the body's struggling to catch up with all
right.
of that process.
So if we do that once and twice, it's fine. But if you look at modern society, drinking soda can be 3 times a day.
Yeah.
And that puts a huge strain on our pancreas and our liver to process.
And that strain over time breaks everything down.
It makes our body inefficient to be able to produce enough insulin to handle the amount of sugar that's in our bloodstream. And so dietary-wise, of course, we prefer people to be eating foods with low glycemic index, which means more complex carbohydrate, which means that it stays in your GI tract a little longer, so it doesn't give you the big sugar spike that we talked about earlier. And ensure there are adequate fiber so that they keep the food in our GI tract. Also, combination of food is helpful. So which means if you're including a complex carbohydrate, a little bit healthy vegetable fats, and also...
Most people don't know what a vegetable fat is or a complex carbohydrate is.
Okay.
So how would you break it down simply for someone?
So a complex carbohydrate, I talk about in case in the morning people are having, simple rice cereal, a complex carbohydrate would be a whole grain like oatmeal.
Right,
yeah?
So something, you could make it simply, say, real food.
That's correct.
That's not been processed. It doesn't necessarily come out of a cereal box, with added sugar and flavors, but something that's actually a grain that grew out of the ground. It wasn't made in a factory. Right.
And so the whole grains, because that has fiber, and also it takes longer for the carbohydrate to break down to become sugar. And fats, we talk about vegetable oils. And also adding...
So like something you would cook with?
That's right.
Yeah. So what's something good that people should be cooking with?
Olive oil would be good for any kind of salad dressing. Yeah. Safflower oil, canola oil, all the vegetable oil, flaxseed oil, they're all good, healthy fats that also helps to balance our blood sugar.
So in conclusion, a quick conclusion would be something that's real.
That's correct.
As
real
opposed
food.
to something out of a box, out of a tin, or out of a package, that you've got something out of the ground like a grain. You've got vegetable olive oils, something that's not a commercial grade oil.
Yep. And so also in our clinic, we've been treating few very successfully, including dietary change and eating habit change and also lifestyle itself.
So it's a really holistic approach. This is where
correct.
Holistic medicine really is a sweet spot, because we're coaching people to exercise, we're coaching and providing tools with which people can lose weight. We're also suggesting herbs that also have a regulatory influence on the blood sugar. So the diet, the exercise, the regulatory ability of the herbs, that's a nice sweet spot for something that's 91% preventable.
Definitely. Yeah. And also the thing is that if we don't change the pong situation, only hoping, okay, if I just take one medication to stimulate my pancreas to produce more insulin, in long run that's going to fail because the pong situation hasn't changed.
It just the environment will overwhelm it.
Right.
If we could go to our next slide just to keep a thread moving through this. So, again, speaking to your point, a century ago, the average adult consumed 18 pounds of sugar a year. By my rate, that's an awful lot, but 18 pounds of sugar. Today, the annual average sugar consumption in the United States is a staggering 176 pounds per person. This is nearly 100% more refined white sugar than was consumed 100 years ago. And a lot of this is not the idea of somebody, eating nearly 3 pounds of refined sugar a day is pretty remarkable. I mean, that's, 3 pounds of sugar, the thought of, but people don't realize that in their large soda, there's massive amounts of sugar. Even in a vitamin water, there's a lot of sugar. In their spaghetti sauce, there's sugar. That you go out to eat, the restaurant scientists food processing scientists have designed 3 points. They have to hit the sugar, salt, and fat. And they have to increase them in such a way to make us coming back, to that restaurant. So most people, the thought of, well, I don't eat that much sugar, they think of maybe putting 2 or 3 sugars in their coffee. And even if they have 3 or 4 cups of coffee like that a day, that still doesn't add up to 3 pounds, but all the other hidden sugars in the diet adds up to that amount. And if we could go to our next slide, it just amazes me that, when it comes to type 2 diabetes, this talks about what is pre-diabetes. So there's this, there's type 1, there's type 2, but there's also a lot of people heading towards type 2 that don't realize it. And so blood glucose is higher than normal, yet it's not quite diabetes. And you can have pre-diabetes and not know it. Dr. Gertler, you were a conventional gastroenterologist for many years, a number of decades, and then you embraced holistic medicine. So how many, in your estimate, how easy is it to divert pre-diabetes, this condition that's heading towards diabetes, to stop it heading towards diabetes? How easy is it if somebody got down to work?
Well, if you listen to the precepts that Yuanling talked about, it's very, very easy. The big problem there is recognition of what state you're in, knowing that you're pre-diabetic. And nobody really advocates on a routine physical. They may or may not check the blood sugar. They usually do.
So is a simple, for instance, excuse me, but is it, if you do this blood stick test for glucose, blood sugar level glucose, how accurate is that? It's an easy to do test, right? Would that be enough to make you take it seriously and go on to the next step and see your doctor?
Well, yes or no, because you have to know what the limits are, and the limits are changing. They used to be much higher, now they're lower. And you can have a fairly healthy fasting blood sugar and still be pre-diabetic. Doesn't completely eliminate it.
So it's enough of a general warning sign to if it is scoring high that you should go off and see your medical doctor and start to get down to work.
Right, because that would be the easiest way to handle it early on. Lose a few pounds here and avoid the big problems later on.
So our healthcare system is just waiting for those people to convert into diabetes. The idea of wellness prevention, the idea of getting out in corporate environments and being more proactive and finding people who are pre-diabetic could save a lot of costs, could save a lot of suffering.
Oh, yes.
Yeah.
Oh, yes.
So if we could go to our next slide. Which is on, the simple idea of regular physical activity and weight loss. I mean, you don't have to be a brain surgeon it's pretty simple, right? The idea of just walking 30 minutes a day, of losing, 5 or 10% if you're overweight, can stop that. I mean, that is one of the simplest interventions that I can think of.
Right.
So why isn't it working, Artur?
Well, I think, again, the emphasis is on, really, in our medical system in this country, it's treating after the fact. Not enough emphasis on preventive medicine.
So
and
not enough
lifestyle.
education, not enough, proactive in the corporate and the workplace.
I mean, look how much we talk about it. You can't watch a TV show or listen to the radio without hearing some sort of a rally against obesity, a run, awareness, a support group, yet it really hasn't stopped the levels from increasing.
Yeah. If we could go to our next slide, the idea that diabetes prevention, there was a large study that was done that showed that 30 minutes a day of moderate physical exercise, along with a 5 to 10% weight loss, produced a 58% reduction in diabetes. 58% reduction. Just those two simple things. So the people getting the support, it sounds simple, but really changing your comfort foods, we all know is like psychic surgery. It's difficult to change basic patterns we've grown up with. So how do you work with people, Yuanling, to try to have them change these basic patterns?
So first of all, that people have to realize, their health is completely in their own hand. And, that's very inspiring. You don't just go to a doctor to finding out a problem, taking a pill, hopefully that it will go away. It's about, how you can live everyday life to do things and activity to more restoring our health rather than wear and tear our pancreas, our liver, to make our metabolism sluggish. So it's about small change at a time. Once you establish a routine and it become your everyday life routine, you feel good and your body will be healthier. So just like you were saying, small changes.
So how does that work in your practice at the Darcy Wellness Clinic? And somebody comes in to see you, how do you work with them on those dietary issues?
So first I want to bring up their awareness about what they do every day. It's leading to where they at. So they created the path themselves. So in order to change that, we have to work on our everyday, daily things, starting from food. So one simple thing, if you don't take anything out of what we talked about today, one thing I think is very important is that having your main meal during the day. Unfortunately, in our modern society, our last thing is that we are heavy-duty meals at night.
And then not walking around, not exercising, just going straight to bed.
So what's harmful about that is that our body, our digestion tract is most sufficient during the day. And as we get tired, same thing with our metabolism and digestion tract.
Becomes less effective.
That's correct.
Yeah.
It's like you worked all day, you're ready to rest, but we give you 10 jobs to do.
Right.
And over time, what happens is that our poor body is being overworked. And that's when everything else comes along with the poor metabolism brings.
Yeah. If we could go to our next slide, if we could do the next couple of slides in quick succession to move through. So strategies for losing weight, implementing a weight loss program, work with a nutritionist or a dietary specialist like Yuanling for a combination of meal planning and physical activity is very important. If we go to our next slide, healthy nutritional recommendations are increase fruits and vegetables, real food, whole grains, real food versus unreal food that's in a box or a can or you buy at Store 24. Include, dry beans and lentils, drink water, calorie-free drinks, not sugary drinks. So cut back on high-calorie snacks and watch portion sizes. And on to our next slide, the downside, like you were saying, to just relying on a pill is that, there's side effects to prescription drugs. There's rapid heartbeat, shortness of breath, headaches, weakness, weight gain, fluid retention. And on to our next slide, there are preventatives out there like gymnemnia, which is an Ayurvedic herb that's been shown to block the absorption of sugar in the intestines and is very helpful for pre-diabetic and diabetics. The maqui berry extract promoting healthy blood sugar levels, increasing antioxidant, the highest antioxidant of any plant out there. And just supplementing with these two can make a big deal of difference. And on to our next one just quickly. Other supplements for diabetes support cinnamon bark. We've covered gymnemnia. We've got bilberry leaf and also fenugreek seed. There's been a lot of research on fenugreek seed going towards different patented extracts and even towards a drug. And then alpha-lipoic acid, which is approved in Germany as a drug for the treatment of nerve diseases and diabetic and alcoholic polyneuropathies. And then on to our next slide. There are alternatives such as acupuncture, and there's an interesting thing here with acupuncture and traditional Chinese medicine out of China, that it's not just about the reliance on say acupuncture alone. But together with modern drugs can also prevent complications of the kidneys and eye disease and neuropathies that are kind of side effects of just treatment with drugs. That acupuncture can knock those hard edges off and be very helpful. And on to our next one, or we might be done, I think, is if we come back actually to the studio to. So Arthur, we just covered a lot of ground very, very quickly. What would you urge? I mean, basically somebody could save themselves a lot of suffering by seeing you, getting checked out. What would you do if somebody walked into your office at Darcy Wellness Clinic and said, okay, I want to get checked out, I want to make sure I'm not heading towards anything bad? What would you do?
Well, there are several tests we can do, and unfortunately a lot of this depends on how much money the patient wants to spend, because many of these tests are not paid for by routine medical insurance. But you want to take a good nutritional history and a lifestyle history and see what their vulnerabilities are, what the family history background is, whether they smoke or drink, have heart disease, cancer, diabetes in the family. And then you can do a few general tests to see how healthy metabolically they are.
Actually, just going back to that a little bit, so there are predisposing factors like family history. Like if you have a brother with diabetes, your incidence of developing diabetes at some point in your life goes up by 50%. So there are genetic predispositions like, Afro-American heritage, Pacific Island heritage. They're much more predisposed to diabetes than. Are there any other kind of factors that you check for?
In general,
that would kind of
just
point in the direction of that they could head towards?
Well, of course, obesity is a big one.
Yeah.
That's the major...
so that's why you do the whole dietary thing, is to find out how bad their dietary habits are.
Right. And pretty much you're screening them with a blood sugar.
Yeah.
If you want to
So
go
what does
further.
that look like, the blood sugar? You do a blood test, and what kind of levels are you looking for?
Well, it used to be anywhere between 80 and 120. Now they're saying 80 to 100.
Yeah.
And above 100 to 120, that's the pre-diabetic area.
Yeah.
And if there's any question, you just get a hemoglobin A1C, it's called, how much sugar is on hemoglobin, and that's much more sensitive.
So after these tests, you get a sense of if they're pre-diabetic or more imminently diabetic.
That's right.
Yeah. And then what do you do?
Well, then you want to get them on a good dietary program with good, strong nutritional supplements and vitamins, and certain of the vitamins and the supplements that we talked about here that help metabolically process sugar metabolism, and insulin. In other words, a healthy pancreas, a healthy GI tract, healthy liver. Correct the lifestyle things as much as you can, and again, call in Yuanling to give them nutritional counseling. Get as much help as you can. Most of the things that you can find on somebody, even if it's not diabetes, can be corrected by lifestyle and dietary medicine. So we really work on those.
Yeah.
If we see the blood sugars elevated in the early phases, I think this can be reversed just with diet and supplements, herbal.
So you can recover. I mean, even
yes.
if you've been diagnosed as diabetes, some people with type 2 diabetes who are still producing insulin, there is an opportunity to recover. It is not a sentence for life if they make these changes.
Absolutely.
Yeah.
There are people who have lost the weight and done the right things, nutritionally become normal.
Yeah, until they're able to come back off all medications and recover from it.
Right.
So Yuanling, in summary then, how do you work with people? What should they be doing?
So just be aware, be consciously eating, consciously living, and also being physically active, because this is part of life. We want to get the water flowing in the river. Right. We don't want to pond.
So, and as far as, that's your registered dietitian speaking, but also as a herbalist and, a traditional Chinese acupuncturist.
Right. And that's exactly what the traditional Chinese medicine looking at, is that we are just unblocking the pond, get the circulation going so that there's good flow of energy, blood, and an oxygenized going into the cell, so that our pancreas can be strong, liver processing things can be strong, so that our body can recuperate. Our body is a wonderful system. It can heal from anything as long as we create the environment for it.
Right. Thank you. So the idea then of using acupuncture, of using herbs, of having a more holistic approach by exercising and also getting your diet under control can reduce, 91% is preventable of type 2 diabetes. So everything we've covered this evening is really a very powerful non-drug, non-surgical approach to getting your life back and not heading down that very dark tunnel, of diabetes and where it can lead. So I want to thank the studio guest, Yuanling Liu, acupuncturist and herbalist and registered dietitian at the Darcy Wellness Clinic, Dr. Artur Gertler, medical doctor with a holistic practice at Darcy Wellness Clinic, and myself, Geoff Darcy, acupuncturist and herbalist. I want to thank you very much for joining us for our discussion on diabetes today. Thank you very much.